Hello, once again, friends and colleagues across the globe. Dr. Pavel Krastev here, New Hyde Park, New York. Thank you for joining us today on this beautiful Sunday. We had a fantastic presentation before this one with Dr. Druby, and now I'd like, on behalf of myself and Dr. Shah and Global Summits, to welcome all of you to our second show today. We have a beautiful young lady from India, Dr. Mohini Daultani, which I will introduce shortly. She's a mother of a small baby, and she actually, in getting to know her a bit, she is very involved in doing exactly what we do with Global Summits, which is namely sharing knowledge. And, it's interesting that Dr. Daultani expressed the desire to teach further with us and to perhaps join some of our other platforms in the future where she could share her knowledge with all of us across the world. So that brings me to mention what I'd like everyone in our audience to understand is Global Summits was pioneered a few years back, and that's the mothership. So the mothership operates, I think, upwards of 30 platforms at this time. And we do different things. We have different goals in each platform. However, our core is to share knowledge and to promote and unite the D2D movement, or what is also known as the doctor-to-doctor movement. So we believe in uniting our profession. We believe in controlling our profession. And when I say our profession, that means healthcare in general. We would like to return the autonomy that doctors have lost little by little to insurance companies and to big pharma, etc. So we believe that healthcare should be managed from within by us, as opposed to third parties and persons that really have no business in running healthcare in our lives. So. Well, like I said, we have a great presentation. I'm going to introduce to you Dr. Mohini now. Dr. Mohini, say hello to our audience and tell us a bit about yourself, please.
Yeah, surely. First of all, good evening, everyone. Here it's evening in India. I'm Dr. Mohini Daultani. I'm a periodontist, implantologist, and laser specialist from Navi Mumbai, India. I'm presently a consultant at Apollo Hospital, Navi Mumbai. What I presently do is we do consultations, that is the part of our dentistry. Plus, I am very much actively involved in teaching. I conduct a lot of online courses, online webinars I keep on doing. Plus, I also write articles, and I've already published 2 books to my credit. That is on topic of laser. So this is a small gist about me. Yes, I am a dentist. I've completed my master's. I'm a mother of a child. And it gives me I'm really honored to present at such an international platform, and I'm looking forward to work with you in future at a higher level still, to spread knowledge and to get all the dentistry together at this platform. Thank you.
That's wonderful to know. And as I mentioned, probably something very similar in the last show. I get so excited when I see the young colleagues developing in their profession, learning, expanding their skill sets and knowledge. And, you guys are really the future, and you guys will be setting the bar and the standards of healthcare, for the years to come. So it's really a true honor to meet so many colleagues, and it's one of the huge perks of doing this is you get to learn so much, and it's wonderful. So, ladies and gents, let me read you Dr. Daultani's bio, and then we'll jump into the presentation.
Yeah, sure.
So Dr. Mohini Daultani is a gold medalist in the field of periodontics and implantology. She has received a fellowship of lasers and implants from Kim Zdu Karad. She is associate editor of Contemporary Research Journal of Medical Sciences. She is also brand ambassador of Dental Reach, a digital magazine. She is author of 2 books, Fundamentals of Laser in Periodontics and Basics of Laser in Dentistry, A to Z. She has also developed a website, www.dentalhub.coin, where my aim is to connect dentists worldwide around the globe. She has opened up a page in social media, Instagram titled Periopedia, and Facebook, Dr. Mohini D. Daultani, where my motto is to share knowledge about pink. She is a speaker at various platforms aiming to bring awareness regarding pink to all dental practitioners. She's a recipient of prestigious awards, and I'll name a few. VN Batwadekar Award for the best clinical paper presentation in 2015. Budding Dentist of the Year by FemDent Excellence in Dentistry Awards 2019. Emerging Speaker of the Year by Indian Health Professional Awards 2019. Periodontist of the Year, runner-up by Indian Dental Diva Awards 2020. Dental Excellence Icon Award by Geniuses World Record 2020. Daratham International Award 2020 for extraordinary support and dedication during the COVID-19 pandemic. Dental Excellency Award, Rising Star of the Year by Indian Professional Awards 2020. Top 100 Doctors, National Winner, City Winner by Doctors Choice Awards 2020. And Silver Award winner for Best Clinical Case Presentation in Clinical Category conducted by Dental Scope Academy 2021. She has a lot of publications to her credit. She is also an active member of the Indian Dental Association in Navi, Mumbai. She is also a lifetime member of the Indian Society of Periodontology. She is a consultant at Apollo Hospital, Claudine Hospital, and various private clinics across Navi Mumbai in India. That's a very admirable and extensive resume. And
Thank you.
You know, for someone so young, God bless you. I mean, that's amazing.
Thank you. Thank you so much.
You're so passionate about this. Yeah. Now, your topic today is extremely interesting, and it's probably a topic that I know the least about. Again, as I had the pleasure to see brief snapshots here and there of what you will be showing. It's very exciting, and I certainly look forward to your webinar today. So without further ado, I turn the floor over to you, and
thank you.
Have fun, and let's see your lovely presentation.
Yeah, thank you. Thank you so much for the introduction. I'll start my presentation right now. Slide is not going ahead. A second. The topic for my presentation is gingival depigmentation, basic and beyond. I'll be covering under following contents: introduction, pigmentation of gingiva, gingival depigmentation, indication and contraindication, evaluation before the treatment, treatment methods of depigmentation, a split mouth depigmentation, that is scalpel versus laser, repigmentation, and conclusion. So to begin with, I would like to start with a proverb. The only way to do great work is to love what you do. You can only excel when you really love from whole of your heart and with full dedication. So to begin with, a smile is a reflection of confidence, kindness, communication, affection, success, and joy. So the structure of smile is not only determined by the shape and position of teeth, but also by the gingival harmony. The color of gingiva plays a very important role in oral aesthetics. Most pigmentation is caused by 5 primary pigments: melanin, melanoid, oxyhemoglobin, reduced hemoglobin, and carotene. Melanin, it is an endogenous brown pigment, a non-hemoglobin derived brown pigment that is produced by melanocyte, and basically, as you could see in this diagram, it is located in basal and suprabasal layer. So gingival melanin pigmentation, it could be multifactorial. The first reason is physiological, pathological, environmental, genetics, and systemic. According to Damit Gupta, the distribution of oral pigmentation in individual is as follows. In hard palate, you will find it maximum, that is 61%. In gingiva, it is 60%. In mucous membrane, it is 22%. And in tongue, it is 15%. So what is gingival depigmentation? It is a periodontal plastic surgical procedure where the gingival hyperpigmentation is removed by various techniques. So in which cases do we advise gingival depigmentation? Patients with dark pigmented gingiva, patients with high aesthetic demand, patients with high lip line. Now coming up to contraindication, in which patients we really advise not to do it. In cases where you have a thin biotype, in patients with narrow interdental papilla, in patients with dark skin individual, and in patients who are allergic to chemical agents and cryogens. In such cases, we will be not going for gingival depigmentation. So what are the factors that you have to evaluate before the treatment is? First, clinical evaluation. Next is photographic evaluation. Third is biotype evaluation. Then is a selection of technique. So this is how you will be doing before going for the depigmentation. Now coming up for the first, that is clinically you will evaluate. You have to categorize it with the help of index. So Takashi et al. Was the one who gave the index for it. He categorized it as score 0 when there is no pigmentation, categorized it as score 1 when there is solitary units of pigmentation in papillary gingiva without extension between the neighboring solitary units. It is categorized as score 2 when there is formation of continuous ribbon extending from neighboring solitary units. Coming up to the next index, the most widely used index is Damit-Gupta Oral Pigmentation Index. So it is categorized as score 0 when there is no clinical pigmentation, categorized as score 1 when you have mild clinical pigmentation, score 2 when you have moderate clinical pigmentation, and score 3 is severe clinical pigmentation. Now coming up to photographic evaluation, always make sure you have to take a pre-operative photograph. In that, a grid is superimposed over pre-operative image. The pigmented area is coded with green surface area and is counted. So once the operative procedure is done, the grid is superimposed and we try to take the repigmented area and then that is colored as yellow. So that helps us in the terms of photographic evaluation. And also very important is you can do the analysis with help of images software. And one of the main thing that you have to calculate is red, green, blue component. So it's very important you take a pre-operative photograph and then later you take a post-operative photograph and then at intervals and you can measure your red, green, blue component that is called as RGB value. As you could see, I've mentioned here, that is called as red, green, blue component. Now coming up to the next is biotype evaluation. You have two types of biotype, that is thick and thin. So what is a thick biotype? In this, you will have a tissue thickness more than 2 millimeters. You have a flat gingival architecture. It is square-shaped teeth. It has thick interdental papilla. It is more prone to pocket formation. Now coming up to the next is thin biotype. In thin biotype, you will have tissue thickness that is less than 1.5 millimeter. You have thin interdental papilla. You have got highly scalloped gingival architecture. It is associated with narrow triangular teeth. So this is the kind of biotype you have to check before going for the depigmentation. So how do you evaluate? You evaluate by 3 methods: is visual method, direct method, and measurement by veneer caliper. So visually, you have to make sure you place probe into the sulcus. So if the probe is not visible, it is called as thick biotype. If the probe is visible, it is called as a thin biotype. The next is direct method. At a desired area, you have to give local anesthesia and you have to use a stopper with reamer and place it at the recipient side. And then that you have to measure with a veneer caliper. If the tissue thickness is less, if the tissue thickness is more than 2 millimeters, it is called as thick biotype. And if it is less than 2 millimeters, it is called as thin biotype. So this is how you will be evaluating the gingival depigmentation for biotype. Last is the selection of technique. There are various techniques used for gingival depigmentation. So you have to understand, you should have a sound knowledge which technique is best to go for which patient. So to begin with, the treatment modalities, it's basically categorized into two forms. Methods aim to remove the pigmented layer. So you can remove it completely with either surgical method and chemical method. And there is one more old age technique where methods were aimed to mask the pigmented gingiva with help of graft. So in that case, we have used free gingival graft and a cellular dermal matrix graft, where I'll be discussing each in detail. Now coming up to the first, that is methods aimed to mask the gingiva with graft. So first is free gingival graft and a cellular dermal matrix graft. Coming to first, free gingival graft. So free gingival graft is basically used to increase the zone of your attached gingiva in root coverage procedures. The technique will mask the pigmented gingival area rather than eliminating it. Advantages, like basically it's a very oldish technique. This was the first technique that had come into picture. But the disadvantages, it is invasive, it has two surgical sites, post-operative discomfort is there due to pain, it is a technique-sensitive procedure, you have a ghost-like appearance of the treated site due to hyperpigmentation. So this technique is no longer used, it's an old-age technique. Now coming up to the next is a cellular dermal matrix graft. To overcome the disadvantage of free gingival graft, the next technique came into use was a cellular dermal matrix graft. It can be used as a safe substitute for free gingival autograft in the treatment of gingival hyperpigmentation so as to avoid a second surgical site. Basically, what is a cellular dermal matrix graft? It is an alloderm that is obtained by processing the dermis of human donors. So we obtain a dermis from the human donor, the cells are removed, there we're removing away the source of disease transmission and immunogenic reaction. This leads to a structurally intact connective tissue matrix that is composed of type 1 collagen that will act as a scaffold to ingrowth and replacement by host tissues. This graft is considered to be biocompatible and safe. So this is an alternative for your free gingival graft. What is advantage? There is an elimination of second surgical procedure for donor side. There is decreased post-operative complication, availability of unlimited amount of graft material, and satisfactory results are there. But the disadvantages, actually this is very expensive, and also this is a technique-sensitive procedure and you require a clinical expertise. At presently, this technique is also no longer used. So both the techniques were old-age techniques. Now coming up to the next, that is methods aimed to remove the pigmented gingiva. First is chemical method and next is surgical method. Coming to chemical method, what we used chemical agents in this. It is a treatment method used to destroy the overlying gingival epithelium using a chemical peeling agent. A variety of chemical agents are available such as phenols, salicylic acid, glycolic acid, and trichloroacetic acid. Hirschfeld, he recommended to use 90% of phenol and 95% of alcohol. So how does this act? Basically, the mixture was found to burn out the pigmented gingiva by destroying down the tissues and slightly below the basal layer of your mucous membrane. So chemical agents such as 90% phenol and 95% alcohol have been found to be quite harmful to soft tissue that leads to tissue necrosis and pain. So what was the advantage with this technique? It was quick and very easy method, but the disadvantage was it has inability to control the depth of penetration. Repigmentation and relapse occurred in all the cases. So this technique was no longer advised to use. Now coming up to the surgical methods, these methods are most widely used. That includes Burr abrasion, Scalpel method, cryotherapy, electrosurgery, and laser therapy. Now coming to the first technique, that is your Scalpel method. As I would like to discuss with case starting, so this was the case that I had done. Pre-operative photograph was taken so as to evaluate the index, and we termed it as Damat-Gupta oral pigmentation index score was given as 3. Local anesthesia was given, and we decided to treat from canine to canine, from mucogingival junction to the marginal gingiva. So after doing that, we used split thickness graft was taken. So what is split thickness graft? It consists of your epithelium and little amount of connective tissue. The underlying periosteum remains intact. As you could see in this diagram, this is my split thickness graft. From mucogingival junction to marginal gingiva, you use 15 number blade and the entire slice is removed. So this is the postoperative image. As you could see, immediately it is devoid of melanin and it has, you are having this bleeding here because we have treated it with scalpel. This is the postoperative photograph after 2 weeks. As you could see, the Daultani score had come up to 0. These are pre and postoperative photograph where you could see very good results. As this was Daultani score 3, it had come to 0. So these are the very good results we had obtained with help of scalpel. So what is advantage? It is gold standard, very economical, minimal armamentarium are required, healing period is faster, but the disadvantages are intra and postoperative bleeding is there. It is difficult to master the technique, periodontal dressing may be required. So what are the postoperative instructions you give? The depigmented area is covered with periodontal dressing, that is co-pack. You have to avoid eating hot or spicy food for at least 24 hours. Analgesics and antibiotics could be given. Chlorhexidine mouthwash is advised twice a day for a week. Patient is not supposed to pull his lips. So these are the postoperative instructions that you give to the patient after the surgery. Now coming to the next method is Burr method. It is most widely used. We can use straight diamond burr or you could use a flame-shaped burr. Basically, the mode of application is feather touch light brushing strokes with minimal pressure and copious irrigation without holding the burr in one place for a longer duration. We have the disadvantage of this is, like you do not, you have continuous bleeding with this. So to overcome this, there are new burrs that are used for the depigmentation and that is called as DFS, Diamond Pressy-Cut Tissue Trimmer Burrs. So basically, these are the tips that consist of yttrium stabilized nanostructured zirconia and you place it around 90 degrees to the gingival surface but only with light pressure. And operating speed is around 3 lakh RPM. So what is the advantages? This tip causes immediate tissue coagulation at the surface of the cut. It prevents bleeding completely. There's no water cooling required. Both the tip and the surface will not dull, thus guaranteeing a long service life. So this is the advantage of DFS Pressy-Cut Tissue Trimmer Burr. Now discussing a case with this. This is a case where I had done depigmentation with diamond burr. After giving local anesthesia, I measured the index and I categorized it and gave a score of 3. That is DOPI score 3 was given. After giving local anesthesia, the burr was used with very light feather touch, minimal pressure was done, but we made sure that you have to have a copious irrigation and only light brushing stroke should be used from mucogingival junction to the marginal gingiva only. So this is how it looked post-operatively. You could see this is my exposed connective tissue. This is my free gingival groove. These are the bleeding point and it is completely devoid of melanin. This is the post-operative photograph after 2 weeks of follow-up. And now let us see what was the advantage of this. It is simple, safe, economical, easy to perform, less discomfort and easily acceptable to the patient. There are no specific equipments required, but the disadvantages, like you have bleeding with this, post-operative pain is also anticipated and it is difficult to control the depth of action. Now coming up to the next method is electrosurgery method. Basically in electrosurgery, what is a mechanism? It has a high frequency electrical energy that generates heat throughout the tissue that boils the tissue water resulting in steam and that causes your cutting and coagulation of the tissue. So what are the types of loop you can use? You can use a scalpel point loop, you can use a surgical loop, you can use a vertical point loop or a diamond point loop. So these are loops can be used for your depigmentation. So to discuss a case, this was a case where we categorized and gave a score of 4. And after giving local anesthesia, the depigmentation was planned from canine to canine. As you could see, the vertical loop was used in a sweeping motion from mucogingival junction to the marginal gingiva. This is the post-surgical view. As you could see, we had used a loop. This is exposed connective tissue, and you could see there is bleeding also. This is the post-operative photograph where the DOPS score had come absolutely 0 and it was devoid of melanin. Now discussing a next case where you had a DOPS score of 2 and we had used a vertical loop electrode, and in sweeping motion we had done depigmentation from mucogingival junction to the marginal gingiva. This is the preoperative and postoperative photograph, and you can see there is so much of very good results where you had a DOPS score of 2 and now the DOPS score is of 0. So what is the advantage? It basically controls hemorrhage. It permits adequate contouring of the tissue. There is less discomfort and scar formation to the patient, and there is less chair time. But what are the disadvantages? Postoperative pain may occur. It requires more expertise. Prolonged application of current to the tissue may induce undesired tissue destruction. Contact with the periosteum and vital teeth should be avoided because it is harmful to them. Now coming up to one more technique, that is cryosurgery method. So what is cryosurgery? Basically, it is a branch of therapeutic that makes use of local freezing for the destruction or removal of the tissue. So how does that act? Directly it acts by cell dehydration, enzyme inhibition, protein denaturation, and that results in cell death due to thermal shock. So what are indirect effects? There is change in vasculature, immune response of the tissue that leads to cell death. So what are various cryogens that you use? You can use liquid nitrogen, tetrafluoroethane, carbon monoxide snow, nitrous oxide, fluorocarbon, carbon monoxide slush, and salt ice. So what are the various modes you can use? You can use a dipstick method, you can use an open spray method, and you can use a probe method. So how does a cryosurgical unit look like? This is a cryosurgical unit that is used in hospitals. You can also have it in a piston triggered form with probe tip. And this is a discussion of a case where this is a preoperative photograph was taken and DOPS score was measured as 3. And this dipstick method was used where the cotton swab was dipped in cryogen and you roll it forward and backward for only about 20 to 30 seconds. So this is how you get a specialized container where you store your liquid nitrogen. And once you place it in your container, you have to use it very fast because liquid nitrogen evaporates. And you dip it and you apply at the desired area in rolling motion for about 20 to 30 seconds. So this is a preoperative photograph and postoperative photograph where the index had come up to 0. And you can see the results here. So what are the advantages of this cryotherapy? It is easy, rapid to apply. You do not require anesthesia. There is no bleeding, no suturing, and superior aesthetic results. But the disadvantages are postoperative swelling may occur, there is burning sensation, and depth of control is very difficult to do it. There is pain, prolonged freezing can cause tissue destruction, accidental contact can also cause injury to skin. Now coming up to the last method is laser method for depigmentation. Melanin absorption spectrum ranges from 350 to 10,064 nanometer, and therefore that lends itself to treatment of variety of lasers. So what are various lasers that we use for melanin depigmentation is carbon dioxide laser, Ariag laser, Nd:YAG laser, and diode laser. So these are the various lasers that we use with all the specification and the various formats of mode. Now discussing a case with depigmentation with laser. In this case, after giving local anesthesia, we had measured a DOPS score and we termed it as 3. After giving local anesthesia, we used a fiber optic delivery, that is diode laser, in cervicoapical direction. As you could see in this diagram, cervicoapical direction, the laser was used from mucogingival junction to the marginal gingiva. This is the post-operative photograph. As you could see, this is my exposed connective tissue. It is completely devoid of melanin. And you can see one more thing is that is called as laser ablated char tissue. This is the post-operative photograph after 2 weeks. And you could see the results pre-operative and post-operative. This is after 1 year of follow-up photograph. So and coming up to the next case is laser depigmentation with CO2 laser. After giving anesthesia, DOPS score of 3 was given and carbon dioxide laser was used, and it was used in non-contact mode. This is the exposed connective tissue, and this is the post-operative photograph after 1 week, and the DOPS score had come to 0. This is the pre-operative and post-operative photograph. So what are the advantages of laser? It has a clean, dry operating field. There is no pain and discomfort. It is less time consuming. It seals the free nerve ending. They do not require any periodontal dressing. But the disadvantage is laser equipment itself is costly. There's high cost of the procedure. It requires skills to master it. This technique is widely used. Now coming up to the cases like scalpel and laser is widely used for depigmentation. So I presently had done a study where I did a split mode depigmentation. One side I treated with scalpel and other side I treated with laser. So this is a case where the DOPS score of 3 was given, and after giving local anesthesia, depigmentation was planned from canine to canine. So we planned left quadrant to treat it with scalpel. So after doing that, split thickness graft was taken, and as you could see, this is my exposed connective tissue. Next day, patient came up with this, and this was the post-operative healing after 1 day. As you could see, it is completely devoid of melanin. And next day when we did treatment of right quadrant with diode laser. As you could see, fiber optic diode laser was used at 810 nanometer. And this is my post-operative photograph, and it is having that char tissue. This is my post-operative healing. Now this is immediate post-operative photograph. As you could visualize the both. The scalpel treated site, you have this exposed connective tissue. In laser treated site, you have char tissue. There is no bleeding, but in scalpel, you have bleeding. So this was the main difference. Now coming up to the preoperative and postoperative photograph, as you could see the results, in this photograph, you can really not understand which side was treated with scalpel and which side was treated with laser. And I had published a study on this, and I published it in PubMed article, that is Journal of Lasers in Medical Sciences, where I concluded that the finding of present study suggests that gingival depigmentation was effective with both scalpel as well as laser. However, laser-treated sites showed reduced pain experienced by patient and better operator comfort. So slight melanin repigmentation was observed in 3 subjects with scalpel depigmentation procedure at the end of 1 year. So this was the conclusion that I had derived from my study. Now coming up to repigmentation, very widely and most common question the patient will ask, once I do depigmentation, do I have a chance of repigmentation? Yes, you do have a chance, and you have to make sure you inform the patient. It will be, but it will be not same as before, and you have to always keep the patient under follow-up. Depigmentation refers to the clinical appearance of melanin pigmentation following a period of clinical depigmentation. What are the factors affecting repigmentation? Smoking, sun exposure, genetic determination, methodology of treatment, and follow-up. So these are all the factors that affect repigmentation. So hypothesis suggests that recurrence can occur as early as 24 days to as long as 8 years. So how do they occur? Basically, the mechanism suggests that the melanocytes from the adjacent pigmented tissues migrate to the treated area and cause repigmentation. However, the majority of available literature suggests that the recurrence rate for your cryosurgery and laser is absolutely less. So as to just show you one case of repigmentation, this is a case where we had a DOP score of 3 and we had done a treatment, depigmentation with scalpel. Copac was placed and this is the postoperative healing after 1 week. This is 1 month postoperative and you could see there's improved outcome. Same depigmentation was planned with lower quadrant also with laser. You had placed Copac and this is the photograph after 3 months. As you could see, there is mild spot of recurrence already occurring. So this is a pre-op and post-operative photograph where you can clearly visualize the DOPA score here is 3. Here you could see it as 1, but you just have a small solitary units of repigmentation of gingiva. What were the post-operative instructions that you give to the patient? The do's are, you have to brush very slightly. You have to advise for soft diet, use mouthwash and use analgesic and antibiotic if prescribed. The don'ts are no spitting, no smoking, do not use carbonated drink and avoid hot and spicy food. So as to conclude, scalpel technique still remains the gold standard. Chemical agents are harmful to oral soft tissues and this technique is not in practice. Pre-gingival graft is not advised for depigmentation as it requires second surgical site. Abrasion technique has been also used, but it is very difficult to control the depth of action. Laser and cryosurgery are widely used and it also has less chances of your repigmentation. Gingival repigmentation may occur, so follow-up is very much essential. To quote few studies, it has concluded that clinical repigmentation after gingival depigmentation is outcome of histological changes in melanocytes. So surgical stripping for gingival depigmentation still remains the gold standard. One more systemic review has quoted that cryosurgery, electrosurgery, and laser surgery are the best choices for treating your gingival depigmentation. These are my following references, and I would like to say thank you by a quote. A winner is a dreamer who never gives up. So dream big, stay positive, work hard, and enjoy the journey. Thank you, everyone. You can connect with me on this social platform if anything is required. And I would like to thank once more to Global Summit and Dr. Pavel for giving me the opportunity to present. I'm really overwhelmed and happy. Thank you, everyone, for your patience hearing.
Dr. Daultani, that was really a fantastic and enlightening and educational presentation you did, and I tell you, thank you so much.
Thank you. Thank you.
This is such a hot topic, I think, in my opinion, that again, I tell you the truth, and most of the time I tell you guys the truth, but I didn't know anything about this, how you can take care of this, how you can manage it, and now I'm going to start doing this in my office. So I just didn't know. Because see, you got to understand, in my office, we're still using candle power. We light candles and we go to work. So I'm a scalpel kind of guy. I do things with the scalpel. So, but this opens up so many new venues that I think it's only just if we can offer this service to our patients in the least. Because sometimes if you're unaware that you can do a particular technique and enhance someone's smile, then you don't offer it to the patient. Clearly, I wasn't offering the service to my patients, and I'm going to start because I think the results you showed, the slides, the pre-op and post-op results, you blew me away. I'm literally going to sharpen my scalpel after this and start practicing on a typodont. So I want to ask you, do you find that there is a large demand for this procedure?
Yes, there is large demand as in today's generation where we are so much conscious about our aesthetic, we are so much conscious about our smile. No one wants to have that black gummy smile, or that black gums. So patients do come to us, I want to get my black gums rid of. I want to have that beautiful pink smile. So we try to avoid those procedures because we don't know it. Once we know the procedures, once we know what are the various surgical techniques, we can surely do it, and there are beautiful results. We just know one technique, that is scalpel, but yes, we have a lot of techniques that I've showed you. Like laser is one of that is very widely used for depigmentation procedure, and we can get very good results, and patient will also be very happy.
Interesting, interesting. Another question that I guess is worth mentioning: how do you determine the fee that it's reasonable and customary that we can charge a patient for a procedure like this? Is it by quadrant? Is it done in a similar fee scale as, let's say, minor periodontal surgeries? How do you base the fee?
We charge, this is a cosmetic procedure, we include it, and we basically do it from canine to canine for upper and lower quadrant. And around, I could not put in terms of money. I think it depends also from area to area, the way of practice you do. So yes, this is a cosmetic procedure and it is not counted under minor periodontal surgery. Yes, it is a cosmetic procedure, and accordingly you can charge as per the area where you stay and the kind of practice that you do.
Yeah, yeah. The other thing that it came up in some of the comments, one gentleman asked about, and it's a twofold question, so let me ask you both parts. He asked about vitamin C. Do you use vitamin C when doing this procedure, injections? And his second part was, do you use antibiotics? Now, my logic, and I'm no authority on this procedure, but my logic tells me if I have a healthy patient and they're not compromised in any way, shape, form, and they don't have any artificial titanium in their body, and they don't have artificial heart valves, that I personally wouldn't pre-medicate someone for such a minor procedure, especially if I was using a blade. But again, maybe I'm wrong, and maybe you do follow a certain antibiotic protocol. So I think this gentleman wanted you to comment on that. And let's address that, please.
Yeah, antibiotics you will only give if patient is compromised by any way, like as you mentioned itself, like if he has some kind of implants or something like that, or else analgesic should suffice. And analgesic also you advise patient as SOS if it's required. Like in scalpel technique, you have to give analgesic because he may have pain. In laser treated, mostly you don't have to even require analgesic. So this was the answer to that question. And vitamin C, I have not personally used for any of the cases as of, but yes, it could be also done. But I presently have not used it for any of the cases.
Interesting. And the other thing that I want to kind of drive home today, before we close the show, is I highly believe that dentistry and healthcare is so variable, and there's so much to know, that I always recommend to people and colleagues, find a niche, find an area that really you have a passion for, and then you're bound to find a market for it. Because certainly if you treat one patient, that will become 3 patients, and then that will become 9 patients. And if patients, in my opinion, are your best referral method, in my practice, I certainly do 0 advertising. Other than me being on social media, which I do for the purposes of teaching and sharing knowledge, I don't really take part in social media to advertise myself. And that's why my practice is not even mentioned, I think, in most places. But besides from the point, what I'm trying to say is, this is exactly a great example of how someone can develop this fine-tuned expertise in doing this particular procedure, and then you can become known in your communities that you are providing the service, and then the referral, patient by patient, will certainly generate a practice that you enjoy practicing, because you're doing something that you feel passionate and confident about. So my motto that I like to live by is everything that we do should be about love and passion. And love and passion, what does that mean? What that means is loving what you do and going to work and doing it passionately every single day, because it's what you do and you love doing it. So Leslie, Dr. Daultani, after I thank you so much for sharing your wisdom and knowledge with us, I want to ask you a question. So let's say you're going to be going to a deserted island where there's only 100 people. So it's not really deserted, but it's deserted. So there's 100 people. They have this condition, and you're going to be there for, let's say, I don't know, 2 weeks. What procedure are you going to take with you? Is it going to be the scalpel, one of the lasers? Is it going to be the burr? What are you going to take? You have no choice, one thing.
I will be going for laser procedures because it has less chances of recurrence, and basically it has a better patient acceptance and it has no pain. In today's era, what is very important more than us, it's important that patient acceptance is what it is. So with laser, it has a very good patient acceptance, and I'll be giving the best to my patient with that modality.
So you take the, okay, all right. Yeah. I thought you'd go with the scalpel, but you surprised me.
I would have, but yeah, I just have 100 people, and right now, if patient is my priority and I want to keep them more happy, I would have gone with laser.
Well, ladies and gentlemen, you heard it from the expert. So laser it is. And on that note, I'd like to thank all of you for joining us today for both presentations. Thank you, ladies. You guys did a wonderful, wonderful job. Global Summits, thank you for hosting the event. And we wish you guys best regards. We hope that you will consider buying our new book that was done by the entire organization. And it's the Doctor to Doctor book that just came out literally, I believe, 2 days ago. So please join us, and very exciting. We have the HEX 3 meeting, which is going to take place on July 25th. We hope you can join us. There we'll meet with all the commissioners, and we'll discuss some of the current and trending areas of healthcare that need to be addressed. And we look for your friendships, for your sharing with us. And thank you once again for being with us here today. So on behalf of Global Summits and Dr. Shah, thank you all. Thank you.
Thank you. Thank you, everyone. Thank you.